digluma xamal la ni jar na ko xibaar bi ma la andil Covid-19 mooy corona virus lépp la àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la tax docteur yi ci àdduna ñoom ñëpp a jóg nañu ànd ak ñun ngir yeexi leen ba jàngoro ji jóg fii ci suñu askan leen Red Cross Society ñi tey ñoom yónni woon te ma xamal leen ne wéru askan wi bon leen tax
Good evening to all the followers of COVID Gambia. Thank you for coming on this live. I will just allow some few people to come in before we start updating you with the COVID situation in the Gambia. Thank you for joining. We'll just give few more seconds to people to allow them to get in before we start updating you with the situation. Okay, as usual, we'll start with updating you on the figures that we received from the Health Ministry. Then we'll move on to some few information coming from the Greater Banjul area regarding the COVID situation, and also some information coming from the different regions in the country. We'll just allow few people to join, few more people to join before we begin. Thank you for all of you who are joining this live. We haven't been doing lives in a couple of days, I want to say, but this is due to lots of work that we've been engaged in and lots of things that we had to put together before being able to come on to discuss with you. Thank you, Chadrame. Thank you for joining. Thank you. It's been a while indeed, yes. Thank you. We'll just allow a few more people to join, because that's just to avoid repeating ourselves regarding the numbers and everything else that we're going to talk about. We just allow some few people to join, at least when we have a reasonable amount of people, then we begin. Okay. Just to remind the followers of this page, this is the COVID Gambia page. We are a group of citizens, Gambian citizens, who just have put something during this pandemic, this time of pandemic, so that we can enlighten the public about what is going on regarding the COVID situation in the Gambia, and also engage in discussion, try to have on board some few professional specialists that can enlighten the public about different issues that the public is concerned about. So these initiatives has been going on for a couple of months now, and then we are happy to see that many people are joining and many people are sending in various questions. Some of them we're not able to answer directly, but then we always try to approach like the relevant either institution or individuals that can actually bring relevant answers. So this is what we've been doing, and we intend to continue doing it as long as the COVID-19 is going on in the country. But we hope that the whole situation is going to be under control quite soon, so that we can all resume to our various activities. In the meantime, we always try to update with the numbers that are coming up from the Health Ministry, as well as the general situation regarding the COVID in the country. So we will start with the figures for the day that we've received from the Health Ministry. You can always join our page, and then you have the board that is regularly updated, so that you are never lost when it comes to these figures. If you're not able to access them somewhere else, you can always access them on our page. Before we come out live, we always make sure that to publish some of these numbers, and engage in a discussion after that. So when it comes to the figures of the day that we've received coming from the authorities, what we can say is that there is, if the technical team can just put these numbers on the screen, the total number of cases as we speak is of 3,275. The total number of positive cases since the beginning of the pandemic to date is of 3,275, of which 1,424 people have recovered and have been released from the treatment centers. And you have 99 deaths that have been registered in total since the beginning of the pandemic to date. You have a total number of 99 deaths that have been registered in the country since the beginning of the pandemic to date. Unfortunately, we still have about 1,752 active cases in the country, meaning that the virus is still here, is still well alive in our midst. And we register a number of 1,752. So as we speak, we have, let me see, when it comes to the figures of the day, we have 78 new cases. That's what has been reported in today's report, and 0 new deaths, which is quite commendable. I mean, we are happy to hear that there's been 0 new deaths so far, at least on the latest figures that have been released. And all that was conducted on 13,838 tests. Okay, the total number of tests conducted is 13,838 tests so far. Okay, so yeah, that is it from the figures. I'm sure that we will try to come up with an analysis of those figures in the next coming days. Whenever it is possible, it will be interesting to have somebody come to analyze those figures, that like we've done in the past, and then that is going to be happening very soon. Okay, so when it comes to the information that we've been able to gather so far, there's been an amendment regarding the quarantine exemptions. And I mean, so far, we know that on arrival, all passengers on arrival to the Gambia had to go through a mandatory 14 days quarantine. That has been reviewed by the authorities, and it seems as now the new amendment regarding this quarantine is that all passengers must have, on arrival, must have a certificate showing COVID-19 negative test result before being able to get into the country, or before being able to board the flights coming to the Gambia. And the test has to be confirmed at least 72 hours before boarding the flight. And all that is going to be something that will be clearly monitored by the authorities. And this is something quite new because, as we all know, on arrival, passengers were going through a mandatory 14 days quarantine on the cost of the government, which would place people in different hotels, meanwhile awaiting their test results. And if proven to be negative, then they would be released and able to join the communities, their various communities, and engage in their different businesses. So far, it seems as if that has changed coming from the authorities. It seems as if all passengers on arrival will be exempted from the quarantine and will have to provide a COVID-19 negative test to be able to enter the country. Okay, so anybody on arrival who does not have that COVID-19 negative test will have to go through a mandatory quarantine of 2 weeks, obviously, during which the person will be tested, and if proven positive, will have to be placed in the treatment center, and so on and so forth. So everybody has to be aware that to avoid getting into quarantine on arrival, you must have a test showing that, proving that you are COVID-19 negative. Okay. So when it comes to the different regions, we had information coming from Bansang showing that, stating that Bansa is now set to have a new COVID-19 testing lab. This is something quite new because, as we know, all the test work were conducted here in the urban area in MRC or at the Kotu lab, which is something, this is something quite new, quite recent, and it's commendable because this will be part of the efforts to create, this is part of the effort to create testing facilities across the region and make life easier for people living in the rural area. So we hope that with that, people will not have to come all the way to the combos to get tested, or to have their test sent to the combos to be able to get their results and then send back to them in the rural area. All that has now been made much more easy now with this new testing lab that is going to be set in Bansang. So it's quite a good development, I want to say. In the North Bank region, CRR and URR, they have benefited from a training on psychological support and care to support the Red Cross personnel and affected families. So it means that community members in the North Bank region, the CRR and the URR are now going through various type of trainings that is going to help them understand this pandemic much better and sort of being relayed to the community members so that people can get first-hand information without relying on the media. They will be able to get the information from the ground in their communities through people who have been trained and understand how the whole thing goes on. And this is going to make life much more easier for the Red Cross, who is actually so active on the ground, trying to coordinate all these activities and to conduct it on their own. So the fact that they're going to have some help coming from the community members themselves is quite a good development and is going to ease the workload on the shoulders of the Red Cross. So that's a development that is coming from the different regions of the Gambia also. Yeah, so still on the same topic, I want to say the Red Cross has come up with a strategy to engage the community in conducting sensitization so as to ensure that community members engage in doing the sensitization whilst Red Cross supports them. The objective is to try and tackle the ongoing community transmission. So as I just said, I'm just going to repeat myself, community members are now going to get involved or engaged in conducting the sensitization. So it's somehow a train the trainers initiative where the Red Cross is actually involving the community members so that they become relay of meaningful information, I want to say, and also sensitize other community members on the danger of this pandemic and also all the preventive measures and any information that the Red Cross is going to transmit to the community will be passing through these members that have been going through this training. So this is what we have to say regarding the situation in the various regions so far. We're working closely with the Red Cross and trying to get lots of information from them because we know that they are very much engaged on the ground doing lots of very sensitive and difficult work with the different communities in the different regions. And we've also seen the flooding that has been happening these past days. So that combined with the work that the Red Cross has been engaged on regarding the COVID-19, it's making the situation quite difficult for the Red Cross. But with this community engagement, we believe that this is going to ease some of the work that they are conducting. So we are going to have actually a person who is, like power outage from NAWEC. I guess all of you understand. I just want to make sure that everybody is still on before I proceed. Is everybody still connected? Can the technical team inform me if everybody is still connected before I proceed, please? Right, it seems as if everybody is still here. Right, okay. Nene, let me introduce our guest. This is Nene Sala. Okay, technical team, if we could have Nene's title and name underneath for the public, please. Nene, if you could just unmute your mic, please. We can't hear you.
I'm right here.
I'm just going to, okay, good. Thank you. Just allow me 1 second. Okay. Yes, we have a guest tonight, which is Nene Sala. She's a medical research scientist. We're very happy to have her here. She's been seen around on various platforms answering questions related to different science-related issues, I want to say. And we are very happy to have her here with us tonight. And we're going to engage in some little discussion. And we'll also invite the public to ask their questions if you have any. You are most welcome to just type in your questions and she'll be answering them to the best of her ability as they come, okay? Nene Sala, thank you for being with us.
Thank you so much for having me, Bintou, on COVID Gambia. I'm really excited about this.
Great, thank you, thank you. Okay, let's just start with the first questions, and we would like to know your perception of this pandemic from a scientific point of view. It's quite interesting.
So from a scientific point of view, I mean, the pandemic hasn't, I guess, taken us by surprise as much. I mean, as scientists, especially if you're involved in infectious disease, you constantly think about what will be the next epidemic. I think the different thing for COVID is the fact that the coronavirus itself, this one in particular, the SARS-CoV-2, is new. So we've been discovering lots about it in a glass box under immense public scrutiny. So as we're discovering things on a daily basis, we're doing it under the watchful eye of the entire world and under immense pressure to deliver. So unlike other coronaviruses, the one thing that we had learned in the early days was this coronavirus in particular transmits very, very easily, which is why it's very, very hard to contain the spread of coronavirus.
Sure. Okay. Right. Okay. That's quite insightful. If anybody has a question, we will allow you to come in with your questions as we go. But for now, I'm just going to go on a little bit more in the discussion, and then you can just take the floor to ask your question. So what is the general atmosphere of in the science and research field these days, knowing the urgency to find a vaccine? Is there intense collaboration going on, the different countries or the different states exchanging information? I don't know, or is everybody keeping the information to themselves, hoping to be the first to elaborate a vaccine?
I mean, I think there's a bit of both. When it comes to vaccine production, I mean, you're not going to reveal early on, what exactly it is you're working on, because from a, I guess, commercial standpoint, there's the issue of regulation and patents and, the profit-making aspect of it. But there has, of course, been, everyone has the same objective, because
Sure.
Coronavirus has gone beyond just affecting health, but affecting economies and bringing the globe on a standstill. So there's been an increased and accelerated sharing of information. So, as researchers are discovering, they're publishing their data online for fast and easy access, and this is driving collaboration and discovery. I mean, so I think those are some of the pluses. On the downside, of course, with all the pressure, sometimes, if we're not cautious, we can be cutting corners, and that's what governments and research institutes are trying to avoid, particularly with regards to the vaccine, because it is something that we know is like our main exit strategy, so we have to do it well.
Sure. So, but you've seen like really good collaborations going on in terms of sharing data and sharing information between different countries. Have you experienced that so far?
Yeah, so you do have collaborations between, the academic world where most of this research happens, most of the basic research happens, and industry. Sure. So, you would have like a university collaborating with a pharmaceutical company. So that's, for example, Oxford is doing that with a vaccine, collaborating with AstraZeneca. And then on a country level, because to test the vaccine, you need to test it in a population that has been exposed and has a lot of people who are infected. So, some countries are testing their vaccines in other countries. So, UK is testing one of their vaccines in Brazil because there's a high proportion of infection. You have, so there are agreements between countries as well. And I think this is all for the greater good, to be fair. And even when it comes to the vaccine for COVID, all countries are trying to band together to avoid, vaccine nationalism, which is, having some countries try and hoard or buy all the supplies. So I think with Africa, for instance, they're trying a centralized approach where they're working with the Africa CDC to try and have access to those vaccine markets, and another organization known as Gavi, so the Global Alliance for Vaccines.
Right. Okay, that's quite interesting. So when it comes to Africa, I mean, we're not hearing so much information regarding the research on the vaccine, but I'm sure you can tell us more about what is going on in Africa in that aspect.
Yeah, I think the truth is, for most African countries, like vaccine production is not something that we've readily been involved in. I know that Senegal is working really hard and have been on the diagnostics front, but we work, like, our efforts are so fragmented and not many countries have that capacity. So to have vaccines, you need the infrastructure, you need the research institute. How many African countries have that? I mean, you have the big ones like South Africa, East African Institute. So we're not necessarily at the forefront of that process. But because of our existing collaboration,
but I mean, it's. But it has to start from somewhere. So I will have believed that at least some little initiatives would be started in some countries that have the capacity to start at least something in that sense, because it doesn't necessarily have to be a big research institute at the start.
I mean, it doesn't have to be a big research institute, but these things cost a lot of money. So you need to have those investments, not only in the infrastructure, but in the science itself. So if the government, for example, doesn't make those investments, then, you're not prepared to either start or scale up. And then you have the issue of the human resource end as well. So, are people there trained to do it? And we have some amazing scientists on the continent. I think, the issue more comes from funding than anything else.
Of course. Okay, right. I'm seeing the connection acting up a little bit. I don't know if you're receiving that same signal as I am, or is the connection good at your end?
Yeah, it's fine. I think it was just lagging a little bit.
All right. Okay. So we've seen some countries claiming to be close to finalizing a vaccine. Like we heard of the Emirates who had announced something in that sense some few months back. I don't think that we've heard much coming from them of late. But then more recently, we've heard about, we had heard about China as well at some point. And then more recently, we started hearing about Russia. Okay. So does that mean that we're almost there? Does that mean that we're close to being liberated, I want to say?
I mean, we're closer than ever before. That's a fact. I mean, there's been a lot of work that's being done. And I think, when you hear there's a vaccine, like, we need to be cautious that at the moment there are candidates. So these are potentials, right? So they're not at the stage where they're ready for use, even though some governments would have us believe that, they're going to use them regardless. Because we need to understand is before a vaccine is licensed for public use, it goes through several stages. So,
of course,
what we call phase 1, 2, and 3. And these are clinical trials where different things are tested. First, whether the vaccine is working, so whether it has that immune response that you need to be protected, and also whether it's safe for use. So what are the side effects? So all these things you're understanding in different steps. And also, how much of it do you need? So what's the dose? How much do you need to give an individual to be protected? Sure. And all these have to be tested in large sample sizes. So in big groups of people, so that you can say that, this will definitely be protected once it's given on a population scale.
Sure.
Now, there are a lot of vaccines in that stage of, figuring out whether it's safe and whether it can provide that neutralizing response to protect you. And the one from Russia, they've just published their findings which say that, okay, our vaccine is safe and our vaccine is protective. The limitation of that is the fact that they only did this in less than 100 people, which is nowhere enough the right amount of numbers that you need to make, such. You can make that conclusion, but we still don't know whether it would work if it goes to phase 3. But I don't think their government is willing to wait. Like, because of the rush, some governments are still trying to cut corners. But I mean, if you do have that in a large number of people, then hopefully we do have an exit strategy.
Right. Okay. Well, let's keep on being hopeful and hope for the best. I'm sure that we'll get there. Okay. So regarding the Gambia, how do you interpret the high and low variation in the number of positive cases that we've been experiencing lately? I mean, for some of us reporting those figures on almost a daily basis, it's quite confusing. I mean, a day we can report 100 and more cases, and another day we'll be reporting maybe 30 cases. I mean, it's quite confusing. And I don't know from a scientific point of view how you interpret that, or I mean, what you can tell us about that.
Well, to be fair, it's hard to tell. It could be a few things. It could be the inconsistency in testing and in how they batch their testing as well. So whether, they're testing samples from the same day or samples from, different days, have they, what the backlog is. So I think that really is driving the variation. But if you look at it on like a monthly scale or weekly scale, as you have there on the screen, you can see the rise in the number of cases is pretty exponential, on a weekly or monthly basis. So I think we've had that fairly standard 30% increase in cases, 30 plus. But I think it's hard to see the patterns on a day-to-day basis.
Yeah, I mean, like I said, for some of us reporting these numbers, these figures, it's quite confusing. I mean, we really wonder what's going on, and it's not really easy to get a very clear answer. But I guess we'll just go by what you just explained.
Yeah, and I think it's hard to rely on numbers alone, because what are the numbers really telling you? It's telling you, I think the take home from these numbers is telling you that the virus is circulating at quite a high level in our population.
Okay.
So, they're not as meaningful at the moment. I think in retrospect, they will be more meaningful when we have more data. But right now, it's just a guideline.
Right. Okay. Yeah, I mean, and in terms of the vaccine, what is this vaccine actually supposed to be doing? Is it supposed to be a preventive vaccine, or is it supposed to be a cure to the COVID-19?
So vaccines are always preventive. So they're supposed to mimic how the virus will be when you are exposed. So essentially, it's preparing your body for an attack. So it's introduced into your system, so you think it's the virus, and then you have an immune response. So that when you actually see the virus the next time, your body remembers it. So it has cells that remember it and know how to fight it. It's like training your soldiers for battle.
Right. So it's supposed to be a vaccine that will prevent people from catching the virus.
Yeah, will prevent people from getting a disease if they were to be infected. So there's two things. There's infection and there's disease, right? So you can be infected without having the disease.
Wait, you can be infected without having the disease. Okay, just explain what that means. So in a non-scientific language, I mean.
Yeah, so being infected is, for example, let's say the virus was on the table, you touch it with your hand, that went into your mouth, it's in your body, but you're not sick.
Okay.
So you have no symptoms. You're not sick, your immune system is strong enough to fight it.
Okay.
And having the disease is when you're sick. Your body can't fight.
Okay.
Yeah.
Okay.
Yeah. So essentially, some means that you won't get the disease, you can kill the virus, and you can't then transmit it to somebody else. So you're breaking the transmission chain.
Okay, and we've heard about some countries performing what they call like the rapid test. Can you tell us more about that rapid test? And is it really effective? Is that something that we could think of for the Gambia, for example? And what is the cost involved? It is something that's something some countries can rely on, like our feeble economy. Do you think that this is something that could be applied in the Gambia, this rapid test?
So rapid tests mean different things in different places, as we're getting to know. So essentially, a rapid test could mean that your turnaround time from getting tested to getting your results is quick, or it could mean that the test itself in the lab is a very quick test, or both. There at the moment, I know in the UK, there's nothing that's been officially, I guess, approved. In the US, nothing's been FDA approved, but there's two different tests that people have been using. And one is the detection of the virus itself using a method known as PCR. And that's what's being done in the Gambia. And that's been standard practice to detect active virus. So one thing that makes it rapid here is the fact that they have a lot of machines doing the tests, and they have a lot of people collecting samples and a lot of people testing. Okay. So I took a coronavirus test last month, and I had my results within 12 hours. And that to me is quite rapid.
So, so that's what it means somehow. It means like the rapid response in terms of obtaining your result. Is that why it's called rapid test?
So that's one way. So the other one, the fact that it's another method that's new. It hasn't necessarily been widely tested, but apparently it could take 90 minutes or less. So the test itself, but then again, the limiting factor would be how many people can be processing the tests in the lab. So I guess for a country like the Gambia, like, do we have enough, staff to be collecting and running these samples? So maybe, I guess, if we think about how Senegal is doing it, because they are developing something that's supposed to work for, that we can have access to because of the financial limitation will be removed for something about $25 a test, I think, if I remember correctly. I might be wrong. But
yeah, I mean, I know in SAFA it's about 40,000 SAFA, which should be something like 40,000, about $4,000.
Yeah, so I think it's around that, right? Maybe less. But that, I think, might be accessible.
Sorry?
I think that might be an accessible price point if, of course, it's subsidized by government as well. I mean, I'm assuming most of these tests will be paid for by the government, which is what I've had in the UK, because most people won't be able to afford it on the grounds of cost. There's another test which is also meant to be rapid, and that's based on detecting the response to the virus. to say that you've been infected, but it doesn't tell you whether you're actively infected or you've had the virus before. So it's not useful as a diagnostic, but useful to know, to assess how many people in the population have had the virus.
Okay. All right. Okay. So, I mean, would you say that this is something that could be implemented in the Gambia, knowing the context of the country?
In the long term, yes. In the short term, it's debatable because
that question, because we've seen many people.
I think if we can overcome.
I was just saying, I'm asking you that question. Trying to, let me see. Are we okay with the connection? Is everything okay?
Yeah. Mm-hmm.
Nene, can you hear me?
Yes.
Okay. Yes, I was asking that question because we've seen lots of people like suggesting to the government to try and implement this rapid test, especially on arrival at the airport, to avoid people going to quarantine. Or realistic.
Can you hear me? Can you hear me?
Yes, I can hear you. I'm getting you.
Yeah, I mean, I think that.
Can you hear me?
Yeah, I think having a test done on arrival would definitely lower the burden on the economy for what they're spending on hotels for quarantine. And, home quarantine is not going to be as easy in our context in the Gambia. So if we can have a rapid test, whether it's by scaling up the number of people doing tests, at the moment, there's no widely available standard rapid test being used. We're all still trialing different methods.
Mm-hmm. Okay, right. So, I mean, the rapid test will be an immediate an immediate response, I would say, to the situation, or an immediate solution, if I can put it.
Yeah.
Okay, we'll just open the floor for questions as the discussion is going on. Our followers on the page have questions to ask Enesala. We'll just invite you to type in your questions and she will be answering them as we go, okay? If anyone has any question for Dr. Sala, you are welcome to just ask your question. Okay, from the technical side, if you have any questions coming from the followers, kindly post them on the screen and then we will be answering them as we go. Okay. Well, we'll be proceeding with the discussion until we get some questions coming in, okay? So, how from a scientific point of view, how easy is it, do you think, to be able to do the contact tracing? Because we can see, I mean, clearly that this has been quite a challenge in our country from a scientific point of view and data collection point of view. How easy is it to be able to trace the contact of a person and make sure that those contacts are also tested, I want to say?
I mean, I think it is very challenging, even in countries like, the UK, where we have addresses and we have, phones that can be tracked and traced. But in the Gambia, we have many limitations. Like, we don't have proper addresses. We have people who are hesitant to even be tested. We have all those other societal and spiritual barriers. or I guess, traditional barriers. So that makes it challenging. But on the upside of that, I think countries like the Gambia that have had, research infrastructure set up, that are used to doing research and, clinical trials, testing and tracing has been something that they were set up to do already. They've been doing that for other diseases such as tuberculosis, which is transmitted in a similar way. So in a sense, we have some level of preparation and expertise in that already. But I think it's going to be extremely difficult to do that on a population scale. I mean, I guess we're also lucky that it's a small country, but you still see some of those challenges day-to-day basis when you look at the reports of people fleeing and all of that. So it's hard to test. It's hard to see how many people they've really been exposed to and potentially infected.
Sure. Okay. Wow. Right. Well, I mean, that's quite scary. That's quite scary. If it is complicated, then I want to say it's quite scary, knowing how fast this virus spreads around. I mean, if it's this complicated, then it's a bit more. I want to say it's a bit more complicated than what we can understand at our own level. I mean, hearing that from a specialist, I want to say is. Makes us realize that it's not as easy as it seems, because from the general public we tend to think that it's just about contacting the people that have been in contact with that person, with the infected person. If the person is able to name them, going after them and isolating them, and then taking them to the treatment center for testing and all that. But apparently it's much more than that. So it's quite a challenge. Yes, indeed. It's quite a challenge. We have a question from Charles, our keen follower. What are the latest news? How about the new COVID centers in the Greater Banjul area? Are they open for testing, or is it only in the Greater Banjul area or countrywide? Nene, do you have any answer towards that or not?
No, I'm not sure if they are open for testing. I think MRC and maybe the Public Health Ministry were doing the testing. What I do know is that there are now more sample collection sites.
Yeah, the government, the authorities had announced sometime last week that they're opening more testing centers that is going to be now decentralized to make life more easy for the public. And that is supposed to be in different regions and also in the Greater Banjul area in some towns, that there will be testing centers, I want to say, put in place. That's the information that we got. So that's an information that came out sometime last week. So we want to believe this is something that is actually happening now. And we will be verifying to make sure that it's actually being carried on. And so Charles, we will let you know, but this is something that had been announced. Yes, there should be much more testing centers around the country. And that's something that is probably currently going on at the moment. Any other question? Okay. I have one more question, Nene. I have one more question. Let me just take a quick look. Yes. Like how effective do you think that a curfew is in a country when it comes to containing a pandemic or the spread of a virus, I want to say?
I think
is this something that is recommended by science, or is that something that is verifiable in terms of impact?
I mean, I'm not sure if it's a scientific thing. I think it's just more to keep people at home and reduce social activities, which I guess government or authorities feel like they can't really have much control over. So this is their way of enforcing social distancing and having people stay at home. But I think every strategy needs to really be tailored. We really need to think about what do we believe as a country are the largest sources of transmission. Is it people being out at night and interacting? or is it other things? And then we make a strategy based on that. But it is very tricky then, because you also have to think about the economy and not just health, and how do you balance that?
Totally, absolutely.
Yeah, so it's
Absolutely.
that's a very challenging question to answer, and I hope that they are collecting data on what they see, the trends, because that's how you can really understand the patterns of transmission. So after the crisis, are we seeing less cases, from particular areas or not? So then it's good to do this in retrospect.
Okay. One last question. I said last, but this is going to be my last question before I end the live. Globally, what is the situation of this pandemic? We're hearing from some countries that they're going through a second wave. We don't really know what that means at our own level. Okay, a second wave. When in the Gambia, for example, at what is the stage of this pandemic? Have we already hit a wave? Are we getting out of a wave, or we've not even started to have I mean, it's quite confusing. Can you tell us, from a scientific point of view, what is the global situation regarding this pandemic, and what is the situation of the Gambia as we speak?
Yeah, so it's tricky to assess it on a global point of view, because every country or every region is at a different stage, right? If we think about when coronavirus started, or when we discovered it was spreading in China, this was, end of December. So they started early and had all, the mass percentage of their cases very early in the year. So, they hit their first wave in the first quarter of the year and were able to contain spread. And then the UK and the US came, hit their, peak in April, in the spring months. So I think that has been facilitated by movement and travels, because of course, the ease of access when the virus goes on the plane. These are the first countries that will be hit, because they're countries where there's a lot of movement in and out. Gambia, I think we are at our first wave. It's hard to tell what our second wave and others would look like, but I mean, if we look at other African countries, like even Senegal, there are a lot of lessons to be learned. I think maybe in a month or so, when we look back, we will be able to understand that a little bit better. As we discussed earlier, the testing hasn't been consistent, so it's hard to tell. I mean, imagine the first days we were like, one case every 2 weeks.
Exactly. Yeah.
Hundreds. So I think we are at on that upward trajectory for now, unless our containment strategies are working.
So can we call that a peak, or how would you call it?
Well, it's hard to know whether it's the peak now. We're still going up. I think towards the end of the month, maybe we can assess what our numbers have looked like on a weekly or a monthly basis. When I looked at the global dashboard, I was looking at the number of cases that we've had every day, and you can still see that upward trajectory. So it's hard to tell whether we are. Yeah, for the Gambia, it's hard to tell whether we are at our peak yet.
Right. So it's wise to be very cautious, to still be very cautious and not relent in applying the preventive measures, right?
Yeah, I think we absolutely have to be very vigilant. And now that things are changing, I mean, I hear that we're now having, you mentioned the thing about when people arrive in the country, unless they've had a COVID test, they're not going to be required to isolate. They're not going to do the hotel isolation anymore. Is that correct?
Yes. I mean, if they provide the COVID-19 negative test within the 72 hours before getting in the Gambia, they won't have to go to quarantine.
Yeah. I mean, that should help, but then I think the spread is still very, very local, and we have to be mindful, because in Gambia, we have communal living. A lot of us live with so many family members, including people who are vulnerable. So I think, we have to be careful not to expose other people who are at risk at home.
Yeah. Okay. We have one more question. I will let you go through it, Nene, if you can just read the question and answer.
Yeah, so the question is, due to the limited time on trial and testing, how safe are these vaccines? I mean, at the moment, like I said, it does seem like the risks are minimal, but we still have to be cautious that this has not been done in a large scale as yet. While we're very optimistic about it, I think we still need more time. And I feel like it's hard because you do have some governments who are really pushing and saying, oh, we're going to get especially like the US are known for doing this, which is very misleading. It's giving false hope. And I think a false sense of security. We still need to be careful.
Very cautious.
We're not ready yet, but we're getting there.
Okay, well, Nene, this was a very, very, very interesting and insightful discussion. I thank you very much on behalf of COVID Gambia. We thank you so much for taking time to be here with us and to answer these different questions. And I hope that our followers really benefited from all your answers. This is something that we really need on a regular basis because there's so much going on and information is scattered all over the place, so it's difficult for people to really get a true sense of the situation. So this platform is here to actually share whatever valuable, reliable information is possible to share with the public in order to really enlighten people and to really make them conscious and safe enough, I want to say. So having you here is so important to us, and we really thank you for taking time to take part. Thank you so much.
Thank you so much, Bintou and COVID Gambia. I think, like you said, it's really important that we have these conversations.
Absolutely.
Because communication is key. Because the containing COVID is a population approach. I think everyone has their role to play, and it's it's the only way that we can try to get back to somewhat normal.
Indeed.
And I really
on that note, thank you so much. And I hope that we'll be able to have you again on this platform more regularly whenever the need arises or whenever you feel like there's something valuable to share with the public. I mean, you're always welcome. Thank you so much for being here. And thank you for all the followers for being with us, and make sure to continue following our page and to recommend it to your friends and relatives. And we will be back online live whenever we have gathered enough information to share with you. Thank you so much and good night.
dikluma xamal la ni jar na ko xibaar bi ma la andil Covid-19 mooy coronavirus lépp la àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la tax docteur yi ci àdduna ñoom ñëpp jóg nañu ànd ak ñun ngir xeex leen ba jàngoro ji jóg fii ci suñu askan leen. Red Cross Society ñi de ñoom yónni woon te ma xamal leen ne wéru askan wi moo leen tax a jóg àdduna wërngal képp la doon seetu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi loo ñu lu dul Covid-19 yow 2020 dikluma xamal la ni jar na ko xibaar bi ma la andil Covid-19 mooy coronavirus lépp na àdduna li ma jaaxal nag ci moom mooy xàmmeewul bu rek baatoo la ndax docteur yi ci àdduna ñoom ñëpp jóg nañu ànd ak ñun ngir xeex leen ba jàngoro ji jóg fii ci suñu askan yee. ñooy International Trading Center ñoo ne ma ni ma yëgal leen ne wéru askan wi moo leen tax a jóg àdduna wërgal képp la doon séentu suñuy vision suñuy yaakaar ñu wekkoon ko ci yow andi looñu lu dul Covid-19 yow 2020 tas na suñu yaakaar billaay tas na suñu yaakaar déglu leen ma man te ma joxe tegtal yi ci géeju ñu raxas loxo yi mu set te ñu moytu joxante loxo setal fa wóorul boole ca moytu ndaje mbooloo dafa wóorul askan wi nañu saytu ndaw réew mi te ñu téye leen ci biir kër yi ñu bañ a génn déglu leen ma jubtal suñ soldaar yi ci xeex bi déglu leen ma jubtal suñ soldaar yi ci xeex bi Red Cross jàmbaar ngeen yéen a ngi ci xeex jàmbaar ngeen yéen a ngi ci xeex ba guddi bëccëg ngoon yéen a ngi ci xeex Red Cross jàmbaar ngeen yéen a ngi ci xeex dañ leen dem ngeen xus dem yéen a ngi ci xeex Red Cross jàmbaar ngeen yéen a ngi ci xeex bi yàlla teggi ñu tiis wi yaay borom yërmande